For those stations not taking a pledge break, the NewsHour continues now with the challenges female veterans face after returning from war. It's part of our series NewsHour Connect, which showcases public media reporting from around the nation. Tonight's story comes from Scott Schaefer of KQED San Francisco.
Star Lara grew up in Roswell, New Mexico, and was on her way to managing a fast food restaurant. But a conversation with a friend changed all that.
And he goes, "You know what I just did?" "What?" He's like, "I just joined the Army. Do you want to join?" "All right." And that's how I ended up in the Army for 12 years.
Star joined the Army in 1995 and eventually ended up in Iraq. She's one of almost 200,000 women veterans in California.
It fit my personality, fit my drive, it fit my enthusiasm. It gave me so many opportunities that I could never have achieved anywhere else. It just really was that perfect fit for me.
But with all the opportunities the military offered, it didn't necessarily prepare Star or other women veterans for the aftermath.
You change from being very independent to somehow emotionally codependent on those that are around you for that support. You become distracted from things that are happening back at home. It's difficult to maintain relationships with loved ones in the United States or anywhere else.
When she was in Iraq, Star went from speaking to her mother once a week to not calling her for 8 months. And while isolation from family and friends is something all service members deal with, Star says there's something different in the way women handle the experience of war.
I think that men and women process information differently, and we suppress information differently. Women suppress immediately, but because of needing to find a way back to normalcy.
Men and women also have significantly different needs after they're discharged from the military, especially when it comes to child care and mental health. Caitlin Hasser is a psychiatrist at the San Francisco Veterans Affairs Medical Center and the director of the Women's Mental Health Clinic.
We know women veterans have higher rates of single parenthood than male veterans. There are higher rates of homelessness and then also a lot of different societal roles. The average woman veteran I see is usually juggling about 50 things, and her own needs are often not at the top of that priority list.
Women make up about 14% of all service members, but they are at greater risk of post-traumatic stress disorder, or PTSD, than their male counterparts.
One of the traumas with the highest rate for developing PTSD is sexual trauma, and women have much higher rates of exposure to sexual trauma, and therefore, in part, have higher rates of developing PTSD.
The Department of Veterans Affairs says nearly a quarter of women veterans have reported sexual assault by their peers while in the military. The Pentagon reports a 25% increase in military sexual trauma among women serving in Iraq and Afghanistan, things like sexual assault and harassment. And yet, despite these increasing numbers, most of these cases still go unreported.
Even after all these years, I still find it hard to believe that it happened, because I'm such a different person now.
Diane Williamson served in the Army from 1976 to 1979. She says her commanding officer raped her in front of her 6-month-old daughter.
I just think it was one of the classic cases of him taking advantage of his position and me not knowing or learning the ways of how the Army is as far as in relationship to women. After it happened and I left the service, not a whole lot of people knew about it. And I never told my family. So self-esteem was like shot.
Like many women veterans, Diane suppressed her experience for almost 30 years. She didn't know how to deal with the rape or what her rights were, especially within the confines of the military.
You know, you had to use like their lawyers, and there's their rules, and there's the UCMJ, you know, military justice, and certain things that are done. And that's a way of, I think, a sense of control. And not something you can control. You have to use what's there.
It's not a level playing field.
No, it's not.
When women find their way to resources like the Department of Veterans Affairs, more obstacles are often in their way.
It can be very triggering to come to the VA for a woman who has experienced sexual trauma. This is in part because the VA is a reminder of the military where the sexual trauma occurred. It's in part because it's still a very male-dominated environment.
The VA has created a national military sexual trauma support team to do staff outreach and education and advocate for patients.
I think the VA unfortunately hasn't had the best reputation in the past for caring for women veterans, and I think we are intent to change that.
Cheryl Wenell is the women's program manager at the VA Medical Center in San Francisco.
In the next 15 years or so, the number of women veterans in general will be doubling, even though the number of male veterans will actually be decreasing.
The Women's Clinic is trying to address physical and mental health needs with internal medicine specialists, social workers, and psychiatrists all in one clinic, while trying to remove some of the barriers that have stopped women from getting health care in the past.
20 years ago, they would be in a position where they might be sitting alone in a waiting room, and with a waiting room full of men, as opposed to now they have a special clinic dedicated to them. They have special services, special groups that are dedicated to them.
And nonprofits like Swords to Plowshares, where star Lara works, help veterans get back on their feet.
I would like to see it become a process of giving back. So to reach the female veterans, give them that hand up and put them in a position to where they can turn around and do the same, not only to female veterans, but all veterans. That would be my passion, to see us all as a community of veterans helping veterans.
You can find a link to a longer version of Scott Schaefer's story on our website.